Hi guys, it's Dr. Candice. I hope you guys are staying home and staying safe during these times. As many of you NBA fans out there know, Ben Simmons was recently diagnosed with a low back nerve impingement, and I was posed with the question, how would I treat him if he was one of my patients? So I know a lot of you think that when you have a physical injury, you get physical treatment. So hands-on work from your physiotherapist, from your chiropractor, from your massage therapist, but there are a lot of things that we can do as naturopathic doctors to help to support recovery and repair from the inside out. So your body has this inherent ability to heal itself. When it's out of balance, like with an injury, it wants to be in balance, and you want to make sure that you're having the basic needs met. Those basic needs are nutrients, so you want to make sure that you're eating a nutrient-dense diet, adequate protein, fruits and vegetables to give you your vitamins and minerals. You also want to make sure that you are hydrated. So having half your body weight in ounces of water is typically what I recommend as a baseline for anyone to remain hydrated. And sleep. Sleep is really important to the recovery process. You want to make sure that you're getting good quality sleep and quality sleep at the right times. That's when your body is doing all of those metabolic processes to support healing. In terms of specific things for nerve damage, I love a couple of things. An active B complex, particularly with some B12 in it. You want to make sure that you're getting a good quality B complex. And lion's mane is a great medicinal mushroom for nerve regeneration. It's also a great antioxidant and anti-inflammatory in terms of supporting people through pain that they can often get with a nerve impingement. I love turmeric and I love omega-3s. They're both great anti-inflammatories. As always, guys, remember to consult your healthcare practitioner for therapeutic dosing on any of these things or for the right prescription for you. And I hope you guys have a great day and continue to stay safe. Bye.
I would treat Bill Simmons' injury with the use of electroacupuncture would be a twofold approach. The first one being locally, where I would use a deep kneeling technique at the nerve root of where the suspected pinched nerve is. Just to give you guys an example, this is a 40 millimeter needle, which I would normally use. In this case, I would use something bigger, which is a 50, 60, or even a 75 millimeter, which is this. And the objective is to get as close to the nerve root as possible, aiming for the facet joints. And what this is going to help do is increase blood flow to the area, decrease the pain, decrease the sensitization, and normalize the motor activity as well as the sensory activity in through those muscles that's supplied through the nerve roots. The second approach would be a distal approach, where we're targeting the muscles, the surrounding muscles of the spinal cord that would ultimately affect with the stabilization of the core as well as movement of the spine. Those muscles include the quadratus lumborum, external and internal oblique, rectus abdominis, erectors, glutes, and lats.
With Ben Simmons suffering from what is being called a nerve impingement, the manual care and soft tissue that would be a part of his treatment plan actually wouldn't be in the low back or lumbar area where the nerve is actually being impinged. You actually want to work in through the areas above and below where the pain actually is. So doing things like opening up his hip muscles through the front of his hip, through the side of his hip, and through the back of his hip, making sure that those areas are moving well. Also, sometimes when we're in pain, we get into a flexed position. The body is actually trying to protect itself. So working through his upper back and even doing a chiropractic adjustment through the upper back to make sure that he is open and that he has good mobility through his thoracic or his mid-back area are the areas where you would want to apply manual therapy or soft tissue therapies.
Ben Simmons of the Philadelphia 76ers is currently dealing with a hip impingement injury in his lower back, and I'll be completely honest with you guys, I have no idea who this is. I don't watch sports. Like, what is this, basketball? Yeah? Okay, anyway, Dr. J asked me to treat this as if this was a regular client coming in to see me with this injury, so here are some of the things I would do. First, I would have a conversation with the client, getting to know them, building rapport, finding out what their background history is. Then we would do a thorough assessment to get a sense of what kind of restrictions or imbalances the client is dealing with. Because if you're not assessing, you're just guessing. After that, I would use a combination of fascial stretch therapy, soft tissue work, and animal flow to help restore or increase the client's mobility. In addition to that, I would also teach them proper movement mechanics. Because if you don't move it, you're gonna lose it. Afterwards, I would use strengthening exercises to help activate weakened or underused muscles, as well as teaching the client how to build that mind-muscle connection so they can get a sense of what it is that they're supposed to be feeling during each movement. Because when it comes to sport or any activity for that matter, in order to participate, you must activate. All right, thank you guys for watching. That's the video. So I'm your health coach, Andrew M. James. And remember, if you're injured and you're in so much pain that it makes you want to cry, don't worry. Just stop on by the THI. And Jay, if you use that, I want royalties.
Hello everybody, my name is Robert Scott and I'm a health coach from the Health Institute, and today I wanted to talk about some of the strength-based rehab aspects when it comes to lower back injuries. So if we can take a specific example of a lower back injury, we can look at no jump shot having ass Ben Simmons. He's unfortunately had multiple lower back injuries throughout his young career. So when it comes to strengthening the back muscles post-injury or post-rehab, it's very important to do a couple things. First, you got to make sure that you're targeting the correct muscles. So the muscles that we would be targeting would be the core, the back, the hips, and the glutes. By doing so, it will help reduce any unnecessary stress or strain onto your back, your spine, and help reduce injury. 2, we want to work in multi-plane, so working in different directions. For example, just of directional things, a plank, side plank, those type of different planes of the body you're working in. The importance of this is that it helps increase not only your central nervous system, which in turn increases the amount of force that can be produced, but it also helps reduce any muscle imbalances, okay? Which is very imperative if you're trying to make sure that you don't have a recurring back injury. And finally, you also want to make sure that we're working in an endurance-based repetition or sets. For example, we're not going to be doing 3 sets of 10. Don't get me wrong, that's not a bad thing. But when it comes to this particular injury, we would suggest doing time-based. So for example, you're doing 10 seconds at a time, 5 seconds rest. The reasoning why we at THI, I guess, prescribe this is due to the fact that it increases muscle recruitment when we're doing these particular endurance exercises. Not only that, it's important, very important, when we're doing these particular exercises to make sure that our back is flat. All right, so some people know, otherwise known as a posterior pelvic tilt. The reasoning this is because it helps keep your spine and your back aligned. All right, specifically in athletics too, it helps you generate force at a greater capacity and helps also reduce any particular strain that you will be getting. So I'm going to be showing and demonstrating a couple exercises that have been prescribed. Shout out to Matthias for this one because he was a really big influence when it comes to these particular exercises. All right.